Welcome to Steady Balance on Spotify, your space to understand the science behind balance and vertigo.
Hi everyone, I'm Dr. Srija from Bandari Neuro and ENT Clinic, Hyderabad, Telangana. Today I'm going to talk about understanding the difference between central and peripheral vertigo. Let's start with a question that confuses almost everyone the first time they hear it. What's the difference between the peripheral vertigo and central vertigo? Both can make the room feel like it's spinning. Both can be frightening, but they don't come from the same place and they don't carry the same level of risk. Welcome back to Steady Balance. This is episode 15. Let's start simple. What does peripheral vertigo mean? Peripheral vertigo means the problem is coming from inner ear or the vestibular nerve, not brain. Common causes include BPPV, that is benign positional vertigo, Meniere's disease, vestibular neuritis. So, in short, the issue starts in the ear. What about the central vertigo? Central vertigo comes from the brain, especially areas like brainstem or cerebellum, which process balance. So, the key difference is peripheral means ear, central means brain. Why is this distinction so important? Because it helps us understand both risk and urgency. Peripheral vertigo is much more common, often treatable, usually not life threatening. For example, BPPV can often be treated with the simple repositioning maneuvers like Epley's maneuver. Central vertigo, on the other hand, is less common but more serious. It may be linked to conditions like vestibular migraine or other urgent causes like stroke or TIA. Let's make this practical. What does peripheral vertigo usually feel like? It often has a very specific pattern with BPPV brief spinning triggered by head movement lasts seconds to about a minute. With Meniere's disease, the episodes last longer, 20 minutes to 1 hour, or often includes hearing loss, tinnitus, or ear fullness. With vestibular neuritis, the symptoms will be sudden severe vertigo. It lasts hours to days, often with nausea and difficulty walking. So, the trigger, duration, and ear symptoms give important clues. When should someone worry about central vertigo? Be concerned if dizziness comes with neurological symptoms such as double vision, slurred speech, weakness or numbness, trouble walking or coordination, severe headache. In these cases, we think about possible brain causes including stroke. Doctors may use bedside tests like HINTS examination to help differentiate stroke from inner ear causes in acute dizziness. But for patients, the message is simple. Vertigo plus neurological symptoms is an emergency. Vestibular migraine is considered as a central cause of vertigo. It can cause recurrent dizziness, motion sensitivity, imbalance, and sometimes headache is mild or even absent. That's why it's often missed. People often panic about tumors like vestibular schwannoma. It is a benign, slow growing tumor of the vestibular nerve, but importantly, it usually causes gradual symptoms like one sided hearing loss, tinnitus, or imbalance. It does not typically cause sudden spinning vertigo episodes. Let's wrap up with these three simple takeaways. 1. The peripheral vertigo starts in the inner ear, is more common and often treatable. 2. Central vertigo starts in the brain and becomes urgent when the neurological symptoms appear. 3. Brief positional spinning, think BPPV. Hearing symptoms, think inner ear. Neurological symptoms, seek urgent care. Understanding the difference helps people respond quickly and appropriately when it matters. Thank you.
A public awareness initiative by Dr. Reddy's. This communication does not substitute advice of a medical practitioner. Please consult your doctor for any medical advice.